Welcome back, everyone. Continuing on with male anatomy and physiology. So 5B is the scrotum and its contents. So basic anatomy, right? We have the penis and we have the scrotum externally, and you can start to see here that we have a testicle sitting in the scrotum, right? So this is just kind of a really basic anatomical diagram. We'll be coming back to these structures in the future. So the first question we have to ask is why a scrotum, right? So why would you have this really important and sensitive part of your body hanging outside of your body in a place where it's relatively unprotected? And it turns out the answer is because you need, in order to make sperm, for things to be a little bit cooler than body temperature. In fact, the optimal temperature for making sperm is about 93 degrees Fahrenheit. Right? Normal body temperature is about 98.6. So you can think of the scrotum as kind of like a sleeping porch or a summer porch, a place that's a little cooler than the main house. And in order to regulate testicular temperature and keep it as close to 93 degrees as possible, there's a muscle right underneath the skin of the scrotum called the dartos muscle, D-A-R-T-O-S. And what that can do is it can relax and let the scrotum hang far, and the testicles hang far away from the body when it needs to cool off, or it can contract and pull the testicles in close to the body to keep them warm, right? To maintain that 93 degrees of Fahrenheit. So you know that phrase, how's it hanging? That actually is referring to like how high are your testicles right now, right? So how high is your scrotum? So we have that dartos muscle that we use to regulate temperature to try to keep the testicles at about 93 degrees Fahrenheit for optimal sperm production or spermatogenesis. So again, heat impairs spermatogenesis, so we don't want the testicles too close to the body. We also don't want to do other things that would cause the testicles to be really warm. So a lot of time in a hot tub or a sauna, for example, or working with your laptop on your lap, because as you may have noticed, not only does the laptop computer itself get warm and generate heat, but also in order to support your laptop, you're having your thighs together, which keeps everything close together and near other body parts, right, and keeps things warmer, right? From the testicles point of view, they want the knees to be out and the legs to be spread so that things can stay nice and cool. This is also where tighty whities or briefs as underwear come into the discussion, because sometimes if someone's having trouble with fertility, it might be that their underwear or their clothing is too tight, keeping the testicles too close to the body and too warm. So how do the testicles get there? So this is a diagram of kind of the indifferent stage of development at the top, and then at the bottom left you see the male pattern of development. So those purple things that you see there are what are going to be your kidneys that are kind of way up in the back here. And that's where the testes start when they start out as gonads. So they start way up in the body, way up near your kidneys, and we have to get them all the way down into the scrotum. So that process of getting them down is called testicular descent, right? They're descending down. So in order to get the testicles down, we have a cord that is made of fibers and muscle, and so we call it a fibromuscular cord, and it has one of the best names ever in anatomy. It is called the gubernaculum. So it's one of my favorite names. It makes a great computer password. Here it is right here, gubernaculum. And it's this cord that you can see here that attaches all the way down into the scrotum. And so what happens during fetal development while the baby is in the mom's womb during pregnancy is that gubernaculum starts pulling the testes down, right? One on each side. So you have two. So pulling the testes down, 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 down. And so that generally around the time of birth or within about 3 months after birth, the testes will be down in the scrotum. Now, of course, when they get pulled down there by that gubernaculum, they're bringing with them the tubes to which they're attached, so the remnants of the Wolffian ducts, which I mentioned are going to turn into the internal ductal system of the male, and that is called the vas deferens. You can see here it's called the ductus deferens. That's the same thing. You'll see the words used interchangeably. So that's this tube that's attached to the testes, and so that's going to come down with it. Also, the blood supply, so artery to the testicle and veins away from the testicle, as well as the nerve to the testicle, are also going to get pulled down into the scrotum, kind of trailing behind that testicle. Because of that, we have this kind of bundle of cords and tubes that came down with the testicle. So you can see it kind of here, right? This whole thing, all this stuff that came down with the testicle. And then they've opened it up for you on the right side. So you can see there's a nerve in there, an artery, the venous plexus, which has another great name. It's called the pampiniform plexus, and then the vas deferens or ductus deferens. That whole bit together, all those cords together, are called the spermatic cord. Let's look at another diagram. Here we go. So this one you can again see the vas deferens. So they use the language that I tend to use more often, right? So the vas deferens, the pampiniform plexus, which are the veins, and then there is also an artery and a nerve that is coming down through that spermatic cord, supplying the testicle, right? It kind of got pulled down after it when the gubernaculum pulled the testicle down. All right, so what is exactly at this point is in the scrotum? So we have our spermatic cord with the artery, the nerve, the vas deferens, and the pampiniform plexus, but let's kind of get into the testicle itself. So here we go. We can again see the testes is kind of at the bottom, and you can also see this coiled tube here, called, kind of like a C around the testicle, called the epididymis, also another great computer password word. So the epididymis. And you can see also they talk about these dartos muscle in the scrotal skin, right? Testicles back up if it's too cold. All right, so epididymis and testicle. If we look at the testicle itself, there's this tough white outer covering called the tunica albuginea. Tunica means like a covering, like a tunic is like a shirt that you put on over something. And albuginea comes from albumin, comes from white, because it kind of looks like a hard-boiled egg, and albumin is the protein in an egg white. So it's this tough white outer capsule when you look at the testes from the outside. And then if you open it up and you look inside, there's these little seminiferous tubules, and this is where the sperm is produced. This is where the magic happens, and they're these little tiny tubes that are all coiled in and packed in there. So I think of the seminiferous tubules as kind of like mini ramen noodles, right? They're all curly and coiled and packed in there. So that's the seminiferous tubules where the sperm is going to be produced. Again, I mentioned that epididymis. Let me outline it for you here in the diagram. So this whole part here is the epididymis, and it kind of coils around and sits around and curves around the testicle. And it's a place that nourishes and transports the sperm. It's the site of their final maturation. I think of it kind of like finishing school for sperm, right? It's like before they're about to launch. It's like, okay, here's the last things you need to do to get ready. And then the vas deferens, also called the ductus deferens. And that's the tube that when ejaculation happens, is going to bring the sperm up out of the scrotum into the body, and then eventually it's going to go through some other tubes to get out the penis. So that vas deferens is the tube that the sperm are going to use to get up out of the scrotum and into the body, so then they can get pushed out. So in summary for the scrotum then, the reason that we have it is for optimal temperature for making sperm, about 93 degrees Fahrenheit. You have that dartos muscle to raise or lower the scrotum so that the testicles can be just the right temperature. Testicular descent happens late in fetal life, right before the child is born or soon after. That gubernaculum pulls the testes down, and then you have the artery and nerve and veins and the vas deferens trailing behind, and they become the spermatic cord. The testicles have a tough outer covering called the tunica albuginea, and then on the inside, these little coiled tubules called seminiferous tubules where sperm is made. The epididymis is a tube that sits around like a seed, the testes, and they go there to mature. And then the vas deferens is a tube that takes the sperm out from the epididymis up into the body when it's showtime. And that's it.